Hi, I'm Jim. I'm from Michigan. I'm 52 years old. I'm married to my wife, Susan. I have 2 kids. I'm an engineer. I built our house. I've installed an in-ground swimming pool, built a pole barn, kind of a workshop for myself. I'm always messing around trying to fix something. When I was diagnosed with cancer, I didn't have the answers. I couldn't solve the problem. That was the scariest part for me. I couldn't fix it. In my mid-40s, I noticed my back was just itching. My original thought was, it's stress. Daughter's moving away, son's starting high school. The itching and the redness, it was intense. And it didn't go away. It just kept slowly getting worse and worse. I remember riding in the car and boy, my back, it was like it was on fire. The itching, it was 24/7. And it was head to toe. I couldn't sleep. I went to my primary care doctor and was referred to dermatologists with blood work, biopsies. I mean, they just kept telling me it was, atopic dermatitis, hives. Every treatment that we tried, steroids, different creams, lotions, it would give you a little bit of relief, but then it would just come back. Over several years, I changed primary care physicians, and the first initial appointment I had with him, I just came in and told him, hey, look, I've been itching for 3 or 4 years now, and something's wrong. The first thing he said was, okay, I like a challenge. He says, we'll figure this out. My new primary care physician referred me to University Hospital. When I went there, they performed a biopsy on a inflamed area of my skin. About a week later, they gave me a call with the diagnosis. The first thing the doctor said, he says, I'm sorry to do this over the phone. He told me that I was diagnosed with a cancer called cutaneous T-cell lymphoma, or CTCL. I also have a variant of that called Sézary Syndrome. He said, take a few minutes, tell your wife. Hung up the phone. Susan and I just sat there on the couch and, all right, what are we going to do? She told me, we're going to beat this thing. Nothing else is an option. We're going to beat it. The first treatment I had was called ECP. There were many other treatments, shots, pills, different things like that. They would work short term. At the time, it kind of seemed hopeless. Fortunately, around that time, I found out there was a treatment called POTELIGEO that was just getting FDA approved. My hematologist and I, we went over the benefits and risks of POTELIGEO and determined that it was going to be a good fit for me. At the end of my first infusion, I just all of a sudden felt cold. The nurses said, okay, yeah, he's having a reaction. They stopped the treatment. They kept me in the infusion center for observation, and after that, we were able to go home. Now, I take acetaminophen and an antihistamine before my infusions, and I haven't had a reaction since then. After my first initial treatments of POTELIGEO, I started to notice my skin clearing up. After approximately a month, my blood work came back, and my Sézary count was 0. They couldn't find any Sézary cells in my blood. So that was an exciting point to know that, hey, something's working. This has been my experience, and it could be different for other people. I've been on POTELIGEO for over 3 years now, and my Sézary count is still 0. Although my cancer is not cured, it's managed. Now, I'm just kind of taking one day at a time, hopefully retiring in a few years and just spending some quality time with my wife and the kids. I guess what I would say to somebody that's struggling with CTCL, you need to fight for your health and get a good support team, doctors as well as family. I know it's easy to give up, but don't give up. You're worth living.
POTELIGEO is a prescription medicine used to treat Mycosis fungoides, MF, or Sézary Syndrome, SS, in adults who have tried at least one prior medicine taken by mouth or injection that did not work, or in whom the disease has come back. POTELIGEO may cause serious side effects that can be severe or life-threatening, including skin problems, infusion reactions, infections, autoimmune problems, and complications from stem cell transplant. Call or see your healthcare provider right away if you develop any symptoms of the following problems or if these symptoms get worse. Skin problems. Signs and symptoms of skin reactions may include skin pain, itching, skin blistering or peeling, rash, painful sores or ulcers in your mouth, nose, throat, or genital area. Infusion reactions. Signs and symptoms of infusion reactions may include chills or shaking, redness on your face, flushing, itching or rash, shortness of breath, coughing or wheezing, dizziness, feeling like passing out, tiredness, fever. Infections. Signs and symptoms of infection may include fever, sweats or chills, nausea, flu-like symptoms, sore throat or difficulty swallowing, shortness of breath, diarrhea or stomach pain, cough. Autoimmune problems. Some people receiving POTELIGEO may develop autoimmune problems, and some people who already have an autoimmune disease may get worse during treatment with POTELIGEO. Complications of stem cell transplant. Patients who receive a stem cell transplant using donor stem cells, allogeneic, after treatment with POTELIGEO may experience complications that can be severe and lead to death. Your healthcare provider will monitor you for signs of complications if you have an allogeneic stem cell transplant. The most common side effects of POTELIGEO include rash, tiredness, diarrhea, muscle and bone pain, and upper respiratory tract infection. Before starting POTELIGEO treatment, tell your doctor about all your medical conditions, including whether you have had a severe skin reaction after receiving POTELIGEO, have had an infusion reaction during or after receiving POTELIGEO, have or have had liver problems including hepatitis B, HBV infection, have a history of autoimmune problems, have undergone or plan to have a stem cell transplant using cells from a donor, have lung or breathing problems, are pregnant or plan to become pregnant. It is not known if POTELIGEO will harm your unborn baby, are breastfeeding or plan to breastfeed. Talk to your healthcare provider about the best way to feed your baby during treatment with POTELIGEO. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. You are encouraged to report suspected adverse reactions to Kyowa Kirin Inc. at 1-844-768-3544 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.